Starting today, getting a COVID-19 test at the health department will look and feel very different. Instead of public health staffers swabbing your nose, now you'll do it yourself. Sarah Hammond tells us why they're making the change and if it could affect the accuracy of those tests.
If you've gotten a COVID-19 test before, you know just how uncomfortable they can be. But now if you go to the health department to get a test, you're going to have to swab yourself.
We are not expecting the individuals to take the swab and shove it way back in their skulls.
Instead of the typical nasopharyngeal swab, the one that goes all the way up your nose, you'll have to do the nasal swab that only goes halfway up. However, Dr. Lance Slade in Macon says it's better to have someone who's familiar with the test do it for you.
From experience here, it is hard to be able to do it to yourself effectively. I think maybe some people could, some can't, but it's always going to be better by another person. You know, that can be objective and won't be timid or worried.
He says you run the risk of having inaccurate results if people do it themselves.
It can't help but be an issue. There's a greater risk of them not swabbing enough to get enough of that the antigen.
But Michael Hawkinson says public health staff members will be right by your car window while you test yourself to make sure it's done accurately. You'll be handed these instructions that tell you first, pull open the swab wrapper. Only touch the plastic end of the swab, not the soft end. Then place the swab midway in your nostril until you feel resistance. Slowly rotate the swab 5 times, then repeat it in your other nostril. Hawkinson says this decision came from the Georgia Department of Public Health. This way, they'll save money by using a lot less protective equipment.
Because they're not in a position where they're actually putting a swab into a person's face, and that puts them in the line of possibility of being coughed on, sneezed on, having viral particles put all over them.
Hawkinson says he believes having staff on hand walking people through the test step by step will ensure accurate results. In Macon, Sarah Hammond, 13 WMAZ News.
The state health department will still require an appointment to get a test.